a couple of minutes late this morning. I appreciate everyone joining us. For those who are faithful followers of the Charlotte-Mecklenburg Police Department, appreciate you rejoining us. For those who are new, a lot of us that are in the throes of this stay-at-home order, I know we've got a captive audience to a large extent. This is something we do as a department, Charlotte-Mecklenburg Police Department does every Wednesday. We have a standing press briefing every Wednesday. Kind of departed from our traditional way of doing things, and traditionally we would have a room full of reporters that were at the ready to ask questions concerning any of the topics that we were discussing. Needless to say, given the March 26th issue or order that was issued coming out of the county, and then not too soon thereafter by the governor, we're doing things a little bit differently, doing this virtually. So just want to explain how things are lining up and let you know that we do traditionally do this, and appreciate everyone following us on social media, and hope everyone at home is safe and healthy and well, and just re-emphasize that we are all going to get through this together. We have several things that we wanted to discuss this morning that we thought was important for our community members to know concerning public safety, and then we're going to transition just in the not too distant future into public health. But want to start with public safety this morning and how it's impacting our community. For those who are loyal followers on social media and conventional media and watch our briefings on Wednesdays, you wouldn't be surprised to know that we quite frequently get out there and scream from the mountaintops just how big of an issue that the department, that the community has had traditionally with guns being stolen from lawful gun owners' cars. A lot of these cars oftentimes are left unlocked, and there were better than 500 guns just alone last year that were stolen from lawful gun owners from cars. They were in their driveways, in front of their homes, at their places of business. Sadly, we haven't seen much of a change in that regard despite a pandemic and these stay-at-home orders that were issued. In fact, to date, there have been more than 200 guns that were stolen from cars of lawful gun owners. Most of those cars, sadly, traditionally, just like what we've had historically, are left unlocked. 12 guns alone just in a 6-day period in the not too distant past. I mean, and you think about that for a second, think about those guns, think about those, where the hands that those guns are winding up in, and some of the crimes that are being committed with guns that are stolen from lawful gun owners who didn't take the time to safeguard those weapons. We can't underscore enough how important, critically important it is for lawful gun owners to be mindful, to be responsible. If you could pay $600 to afford the gun, you could surely pay the $20 to purchase a safe, a vehicle safe, to secure that gun. We're going to continue to scream it from the mountaintops until it really gets traction, because this is having a tremendous impact on all of us as a community as far as public safety goes. No less of a concern are some of the things that we're starting to see with public health, especially in the area of drug overdoses. In fact, since the stay-at-home order was issued on March 26th, we've had more than 100 calls for service regarding drug overdoses. These are people that are in our community, and it transcends age and gender and race. It's touching a lot of our people, and it has for some time. That's a 24% increase compared to the same time period of last year. Now, if you listen to the experts who are really tracking it around the country, they're concerned that this spike is going to continue to intensify with some of these stay-at-home orders, people in closed quarters together, a lot of anxiety out there with the unemployment spiking and people losing their jobs. So that's something that the experts are keeping their eyes on, something that we as in public safety are keeping our eyes on. And I think that would be a good transition point to introduce Cindy Murphy. She's with Anuvia. They're a substance treatment center that we have here that helps our community. They have for some time, Anuvia. She is the director of prevention and intervention. We really thought it would be relevant and helpful to have their perspective on what they're seeing on the ground, reading that landscape, and more importantly, what this means to all of us in the community. So I want to introduce Cindy Murphy.
Good morning. Thanks, Rob. First, I wanted to thank the Charlotte-Mecklenburg Police Department and all of our other first responders for protecting our community while putting themselves on the front lines during this crisis, and for highlighting the important impacts of COVID-19. It is this early analysis and reporting that enables our community to most effectively respond. COVID-19 has created factors that may likely have contributed to the increase in overdoses that we are now seeing in our community. These factors include restricted movement, indirect trauma, limited resources, limited information, lack of social supports, financial insecurities, perceived personal and family risk, and uncertainties for the future. Unfortunately, there's a kind of trifecta for populations with substance use disorders that could hit some folks particularly hard. First, because the virus attacks the respiratory system, COVID-19 could be an especially serious threat to those who vape or smoke tobacco or marijuana. Alcohol use disorder and heavy alcohol use weaken the immune system and increase the risk of respiratory distress. People with opioid use disorder and methamphetamine use disorder may also be vulnerable due to those drugs' effects on respiratory and pulmonary health. Second, the impact of the virus will likely be compounded because many in the substance-using population have decreased access to health care, housing insecurity, and a greater likelihood for incarceration. Third, people who use substances may be more likely to put themselves in harm's way in the seeking of those substances and, when under the influence, are less likely to have the ability to observe the safety protocols to prevent the spread of virus. So that's a bit about the impact on people with existing substance use disorders. Let's talk about the potential for people to experience new onset disorders triggered by the crisis. I'm sure you've seen all the memes. It's 2 o'clock somewhere. It's wine o'clock somewhere. The mom teaching her kids fractions by pouring alcohol into a shot glass by quarters and then drinking it down by the quarters. People often use substances as a coping mechanism. The majority of us will not experience consequences for use during COVID, but for those with genetic factors, familial influences, extreme stresses, and those who had unhealthy patterns of use prior, use during this crisis could have a lasting impact on behavioral health. So that's enough about the negative impact. Let's talk about prevention, treatment, and recovery supports. More information is available at anuvia.org on all of these items. First off, prevention is key. Availability is a major contributor to substance use disorders, even more so now. You can keep your home safe by addressing the following. Lock your meds. If you have medications that you need, keep them secured. If you have medications that you don't need, dispose of them. Secure alcohol. Use a locked cabinet, markers, or other means to make sure that unintended consumption doesn't happen in your home, especially among young people. If you are a smoker, smoke outside to reduce the impact of secondhand exposure. If you're contemplating quitting, use any downtime you have to embrace resources to do so. Stay healthy. Get exercise. Get outside. Follow a routine. Watch your diet, and connect with social supports virtually or through safe social distancing. Next, treatment is available. Anuvia is wide open and ready to help. We have a full continuum of services available both by telehealth and in person. If not Anuvia, there's lots of other community resources open and available. Don't let the virus be the reason you don't get the help you need. Call us or visit our website, and we'll get you to the help that you need. It would be a really beautiful thing for all of us to come out of this crisis healthier than we were when it started. If you're hesitating, now's the time. Do it for yourself and for the people that care about you. For people in recovery, for those that are struggling, seek professional help at organizations like Anuvia. Stay in contact with your support network through daily calls and check-ins. Attend virtual 12-step meetings. In addition to the things I just mentioned about staying healthy, people in recovery are encouraged to build in structured activities into each day, like cleaning the house, calling others, engaging in hobbies, all the things that you would normally do. Take breaks from watching, reading, or listening to the news. Practice good mental health hygiene. Read, journal, utilize spiritual resources, use relaxation, stress stress management tools to manage anxiety. If you're interested in being involved in solutions, there's a great network of people right here in Charlotte, people and organizations working together. The Mecklenburg County Substance Use Disorder Task Force. Check out our Facebook page and get involved. Remember that prior to this crisis, we were on a downward trend in overdoses, so it's all the more important that we're working together to address this disease. My thanks to the Charlotte-Mecklenburg Police Department and to all of you for your time. To the best of my ability, I'm happy to answer any questions that you may have.
Nate Morbido.
Nate Morbido, WCNC.
Okay.
You say his name. Go ahead, Nate.
Oh, go ahead, Nate.
Yeah, you all mentioned the overdose calls as well. But when you look at the data, how much more significantly are we talking about? What kind of correlation can you kind of give us? Is there any data that shows the correlation typically?
Rob, do you want to take that?
What was the question?
Could you repeat your question, Nate?
Hey, Nate, I can talk about some of the statistics that we're seeing from CMPD, from calls for service that have been reported. Just forgive us, show us a little grace on the technology. What was the question with regard to the statistics?
Right, in regards to the overdoses.
Okay, your specific question was what, Nate?
Yeah, have you also seen an increase in unintended deaths?
Unintended deaths? Independent of drug overdoses?
Yes, I mean, I'm sure those are part of them, but cases where people are dying and, you know, there's not someone else there that can say they had a heart attack, you know what I'm saying? Like, or, you know, they were sick before this. Your basic unintended kind of what you all would normally label a suspicious death.
Right. What we have seen is a 24% increase in calls for service concerning drug overdoses. We've had 10 of that 100 that are reported from March 26th to current date that sadly, tragically resulted in a death. Independent of that, people with medical issues, that isn't something that we would traditionally track. We would track deaths of, suicide. We would track deaths of drug overdoses. That's something that we gather the analysis on. And just to further that, on the suicide end of the equation, I don't have the specific number between that time period that we referenced, but I do know that it was flat with the same time last year. We have not seen a spike in suicides. Does that answer your question, Nate?
It does, thank you.
Katie, and I'll turn it back over to Cindy.
Paige.
Good morning, Paige.
Hey there, sorry about that. I actually wanted a question for Rob. Sorry to have to keep going back and forth.
No problem.
Talking about the crimes, the gun crime that you have seen kind of spiking over the stay-at-home order. Have you seen a spike in other crimes because people have just more time on their hands right now? Or are you expecting to see more of a spike?
No, violent crime has leveled out, and what we're really encouraged with is the number of shooting at occupied homes, which has been just a troubling challenge for the community and for us in public safety, has seemed to have leveled out as well over the last week or so. Domestic violence, I don't have the specific statistic with me to reference on domestic violence. That was, and I would imagine continues to be, an issue that we're trying to get out in front of and manage. And, just to dovetail a little bit off that, we've referenced it before, we'll always be appropriately staffed to investigate, to respond to domestic violence calls for service. We as an organization in public safety, we're far more interested in preventing those kind of incidents from occurring to begin with. And there's a multitude of ways of going about advancing prevention, not the least of which is the resources that are available that can be found on our website at cmpd.org. And I would encourage anyone who feels that they're in the throes of a situation that could be potentially dangerous related to domestic violence to reference those resources. There's people waiting. There's hotlines waiting. People on those hotlines waiting to help people out who believe that they're in situations that could be potentially dangerous. But overall, violent crime has leveled out. Encouraging. Chief Putney always says one violent crime is one violent crime too many. So you're not going to find anybody here at CMPD that's spiking the football or doing a victory lap. But it is encouraging to see that the numbers have leveled off somewhat. Lauren, go ahead, Lauren. Is it for Cindy?
I have a question for Rob and a question for Cindy. I can go ahead with my question for Rob first, if that works. Just wanted to see, have you guys noticed any increase in like the DUI numbers as well? With the people staying at home, kind of going into substance abuse?
Right. Have not seen anything that's glaring concerning that, and I think that really speaks to the stay-at-home order. There's fewer people on the cars, fewer establishments that are open because businesses are closed down that serve alcohol. So it would really make sense to see that reflect in the number of people who are out there drinking and driving. So we have not seen an increase in that behavior. I'm going to turn it over, and I know you had a question for Cindy.
Gotcha. Thank you.
If I could just comment on that question, we are still offering DWI services at Anuvia by telehealth. It's a perfect time if any one of our community members has an existing DWI to take care of that while you're at home with some free time on your hands.
Perfect. Could you talk a little bit more about your telehealth services that you provide, and kind of if somebody is at home struggling, what should they be doing? How do they get in contact with you? What is the process of the telehealth help for something like that? And if you could speak to a little bit more of your increased calls and kind of what you've been handling so far.
Sure. I'm going to call on Mackie Johnson, who's Anuvia's Director of Clinical Services, to elaborate on that a little further.
Hi, I'm Mackie Johnson. I'm the Director of Clinical Services with the Anuvia Prevention and Recovery Center, and good morning, everyone. The telehealth services, we're using a platform, the popular platform Zoom, to do a lot of our services. So it's really pretty simple. If someone, they can walk into our office Monday through Fridays, 8 to 5. We have people there that can do an first face-to-face in-person assessment. If someone is not able to come in, you can call into our main number, which is 704-376-7447, and request a telehealth assessment. And then what we would do is we would send the person a Zoom invite or an invite through their email or their text, and you could just join in the call that way. There will be a counselor on the other end, face to face, just like we're communicating right now. Assessment can be done. Once the assessment is done, they would be assigned to a counselor who would reach out to the individual and schedule appointments. We're starting some group activities using the telehealth platform, so there will be multiple people on the participating in the group. It's really interesting. During this time, it's a really effective way for folks to get in contact with each other and for us to provide services.
Thank you, Matthew.
Thank you.
We're going to take a couple more. If anyone doesn't have anything more on that, I encourage you to visit Anuvia's website. There's a number, a hotline number there for anyone who feels like they've been impacted or knows someone who's impacted by substance use, if they're challenged with substance use. Any other questions concerning that from the media, they're more than welcome to hit us on the inbox. We do want to transition, though. We have Deputy Chief Estes with us this morning. He's going to address some of the concerns, questions that those in the community, those in the media may have about COVID-19, CMPD's enforcement activities, efforts, and impact as far as public safety goes. So I want to turn it over to Deputy Chief Jeff Estes.
Thanks, Rob. Good morning. Just a couple of points I want to make. First off, we're still at 5 employees that are positive, affected by COVID, 3 sworn, 2 non-sworn. And of course, we're in contact with them constantly and monitoring their health. I believe that number, that we did, of course, we didn't want any COVID positive, but I believe that number is indicative of the early and aggressive stance we took in relation to protecting our officers. Very early on, we ensured that they had adequate PPE as best we could under the time constraints that we had. We did things like virtual roll calls and roll calls outside the team offices. We ensured that we had strict protocols about officers that were ill, whether we knew it was COVID or not. We went ahead and isolated, and we've continued to refine those, including taking temperatures of officers as they report to work. So I'm very pleased with where we are so far with that. We have, I believe, 22 employees out total right now, but 5 positive. On the enforcement side of things, so we've taken about 2,400 or so complaints. We vetted those, investigated. Many of those were able to educate a lot of folks who had questions about it. We continue to do so. As the time has progressed, I think everybody recognizes that where we are today is not the same place we were last week or 2 weeks ago or 3 weeks ago. And so as the proclamations and orders continue to be in place, total refinements as far as enforcement goes, and the lines get finer as we move forward. So still 16 citations as I stand here, 8 arrests, which was early on, as we talked about a few weeks ago. But as we stand today, on the macro, as I've said, we're very pleased with where we've seen compliance. And on the micro, of course, we're beginning to thread through all of the nuances of the variables that, of course, couldn't be accounted for when you issue a proclamation like this in regards to the pandemic. I just want to say there's no playbook that we have to go by. There is no records that we can find from 1918 to figure out how do you police during a pandemic or enforce proclamations or governor's order. So that is an ongoing process. But I did want to say, if the message was out there and we've heard that any of these restrictions that are placed either from a public health perspective from the county officials or from a policing perspective, that any of these restrictions on freedoms and liberties were taken lightly, I can assure you that they are not. Everyone is only done when necessary, absolutely necessary, and of course, I know that they will be lifted in a good and reasonable way as soon as practical when leadership tells us that. So that's where we are today, and we'll be happy to entertain any questions.
Nate?
Good morning, Nate.
Hey, good morning, Chief. Two questions really. One about the stay-at-home order. Generally, is there any kind of common theme that's kind of running along these complaints? Any general area of the city where most of these are coming from? Any kind of general activity where this is happening? And secondly, just the homeless population. How have your encounters been with the homeless population?
To the first answer, generally it is, and look, we get it. It's an economic calculation for many businesses, and that's generally what we get is that people are feeling the financial strain. They want to know, can they stay open? Are they essential? Are they not? And if they shift operations to sell this instead of that, can they still operate and function? That's where the majority of those complaints come in. And then, for the homeless population, what we have done, we've tried to strike the balance between ensuring that the homeless population was protected, while at the same time protecting the rights of private property owners if they call with a complaint about an encampment on their property. As always, we seek wraparound type services for the homeless population. We have had a long history here at CMPD of ensuring that we do that, not just enforcement minded, but really trying to get help to those folks who find themselves in a homeless situation. That hasn't changed. Now, we also are concerned with ensuring that during this time that the homeless folks have access to food and et cetera. We're doing our very best to ensure that they are allowed to do that when providers provide that for them.
Rob?
Rob, good morning. Rob, you there?
We'll come back.
My bad. I thought I was automatically unmuted when I was pulled up. Forgive me for going off topic here because I've lost track of Stefano talking before, but I just wanted, maybe this is a question for Rob, but I wanted to see if there was any information on the pursuit that began in Mecklenburg County and in Gaston County yesterday.
Yeah, we'll communicate that to the Public Affairs Office later on.
Okay.
Michael?
Yes, hi there. Michael Flower, WFA News. Question, you said there's no playbook here with this pandemic, obviously. Can you all talk possibly about an interaction in the public that your officers may have had with someone that you suspected was positive for COVID-19 and how officers handle that?
Are we speaking of hypothetical, or are you speaking of a specific incident?
If there's a known instance in the last couple of weeks where there might have been a suspected positive case, or even a known person who's positive who said that they were, how officers are handling it.
Yeah, I can't speak to anything specific like that. And of course, we don't like to deal and won't deal in hypotheticals. But what I will say, if our instructions are clear, if an officer has an encounter with a person that's COVID, the first thing is to ensure that their health and safety is taken care of first. That's the main thing, to ensure that if they have medical needs, that they're attended to. Of course, we have protocols in place to ensure our officers are properly protected with full PPE to encounter that subject. And then once we do, again, ensure medical isolation, if is taking place, is adhered to. Again, it's the greater public safety is what we're after. Amanda?
Hey, good morning. I was wondering if you could tell us more about how a virtual roll call works and how it works normally. Also, besides taking temperatures, is there any other ways officers are being screened?
Temperature is a way that they're screened. They're also screened just to make sure we ask the officers or have the officers report if they're feeling well. That's the first one. Even if you don't have a temperature, if you're not feeling right, then we're going ahead and sending you home out of abundance of caution. And I believe, that's bode well. Virtual roll call is just a roll call that's done. The officers come to the team office. They're met outside, or if they already have their vehicle with them, they communicate over the in-car communication systems we have, whether it's through an email or over the radio to give instructions for the day or whatever else they need. Or if not, they meet outside in the parking lots before the tour of duty with well more than the 6 feet gap to ensure that they can get their instructions for the day and then roll out. And just one other point, from the very beginning, one of the Chief Putney's edicts was to make sure that in all of our operations that we were strategic in how we deployed our workforce. So we also took a look at our data analytics on our calls for service and what number of officers were required during a specific time of days, and we're able to apply those formula so that we would optimize and maximize the number of officers we had at any given time over a long period of time. That way, of course, minimizing the amount of officers that we had potential for exposure while protecting the public. Paige, good morning.
Hey, good morning. Question about personal protection equipment for officers. I know you guys have it on hand. Are officers always wearing that, or is it just something they're putting on and using if they think it's a positive COVID-19 patient or someone who's sick? And then second part, how is morale at the department right now with officers during this challenging time?
Let me answer the second one first. I think you just heard about a chase and a capture yesterday. That's indicative of the work that's being done. Our biggest litmus test for morale is the officers' actions and activities. And I can tell you, I'm extremely proud of the officers who are out there facing violent crime head on. Pandemic or not, they're out there getting after it with folks who are committing crimes against our citizens. And so from my perspective, and using that as a gauge, morale is excellent. Now, of course, that depends on what officer you ask, but by and large, I'm extremely proud of the way our officers conduct the business of that. And you have to remind me, I'm not real bright. What was your first question again?
No worries. PPE, I know you guys have the personal protection equipment. Are officers wearing that always, or just when they're having calls where it might be a sick patient, it might be COVID-19 related, et cetera?
So yes and no. Anytime we suspect that we have a COVID patient, they're required to wear their N95 protective mask and other PPE. In fact, on all medical calls, they're required to wear their N95 mask. The other times we've provided them with high quality cloth masks for wear throughout their tour of duty day so that they can be protected as they just go about their normal duties.
Are they required to wear those cloth ones, or is it kind of up to officers?
Yeah, up to the situation. It's a voluntary basis for them, but by and large, we're seeing when most officers, when they encounter the general public and they have to be less than 6 feet, most folks would wear those. All right, I'll take this opportunity to introduce our Chief of Police, Chief Putney, who has a few words.
Got to introduce myself again, Rob. Kurt Putney, CMPD, Police Chief. I just want to say two quick things. One is thank you. Thank you to the general public. For the vast majority of time, as you heard Chief SCs talk about, we're getting cooperation. That's key. The other piece of it is we're learning as we move forward about enforcement around these declarations and orders. And it changes by the day, sometimes by the week, but we're keeping our people informed about, first and foremost, protecting First Amendment rights. And it's a struggle when you're in a pandemic. I think we're learning, we're getting better with every passing opportunity that we engage. The other big thing for us, though, is I want to thank you to the officers because they're doing some fantastic work. You talked about how they're chasing people, bringing people to justice even during this difficult time. They're stepping up. When you call 911, we're rolling. So is the fire department, so is medic. We're doing great work for this city, and I'm proud of that work. We continue to amaze. I'm continued to be amazed by that work. Lastly, in appreciation for that work, we've been working for the city leadership team with the city manager. We wanted to do something special for our people across the whole city, in particular, police and fire who fall under the city, as you know, and they're going to get premium pay. Some people call it hazard duty pay. We don't call it hazard duty pay. The pay that our first responders get on a daily basis is hazard duty pay. This is premium pay because during this pandemic, the city manager intentionally and all the city leadership wanted to make sure we reward those who are critically essential to the performance of their duties throughout the city. And in particular, for our case, those who are providing public safety. The money should arrive in their bank accounts next week. We were hoping this Friday, but it's been extended to next week and is retroactive back to the 26th of March. So that's a small token of appreciation. It is funded through you as a city taxpayer, and it is showing the leadership, the city manager. Also want to thank the county manager for them as they jointly lead us through this very difficult pandemic. First that we've ever had, obviously, during our career, and I think we're managing best because of the great people we have working for us, not just here at CMPD, but throughout the city. If you have any questions for me, I'll entertain those. Again, I just wanted to broadly say thank you for the cooperation and your patience, and we're all struggling to get through this, and we have to get through it together. Do we have any questions?
No. Paige.
Hello, Paige.
Hey, good morning, Chief. Wanted to ask, how is this all impacting the discussion for RNC security? Are those meetings still going on, and how have they changed since this all happened?
Meetings are still going on. We're doing most of them virtually, obviously. I get briefed every week. That is the only face-to-face meeting that we're having. And then we have the broader meetings where we obviously log in and do them virtually through teleconferencing. So they're still going on. We're still planning as if the last week of August, we're going to host a fantastic convention. We're preparing accordingly. All right. In closing, thank you so much. I appreciate the work. We're going to get through this as a city because that's what Charlotte is about. Thank you.
And just to echo the Chief's gratitude for the community. Appreciate everyone tuning in as they do every Wednesday. A little message for the media. A lot of what we covered today will be communicated via email to your respective desks to underscore the data, the statistics, resources, and links that were referenced, in addition to a couple of those questions that the media had, one with regard to that vehicle pursuit from yesterday. Appreciate everyone's tuning in this morning, and we'll look forward to seeing you again next Wednesday, same time.